Will this ICD-10 coding system ever really take place? Why is the transition to these new coding sets so important? And how is it going to affect patient care? These are just a few of the questions on the minds of HIM managers, directors, and medical coders across the nation. This presentation is going to address both the positive and negative components of moving forward with this upgraded coding system. Upon conclusion, the goal is for my fellow colleagues to understand that while there are going to be hurdles and challenges with this transition, the benefits for the upgrade far outweigh any of these initial stressors. For those of you who don't know me, my name is Melissa Winward. I am a small business owner and I work as an independent contracting medical coder. I possess a coding credential CPC through the American Academy of Professional Coders. I'm currently working on a bachelor's degree through Western Governors University in Health Informatics. ICD-9 coding has long been responsible for the overuse of diagnosis unspecified, or diagnosis other. Not to mention that we are the only country that still captures charges using the ICD-9 system. In an article entitled USA Playing Catch-Up from the website medicaldevicenetwork.com, dated September 1st, 2006, according to Jory Frailer, in 2006, over 100 countries at that time were already using ICD-10 coding systems to report mortality data, making U.S. data incompatible with the rest of the global community. Because of the great advances in modern medical procedures, it's becoming impossible to accurately report charges using such an obsolete system. October 1st of 2014 was supposed to be the day ICD-9 transitioned to the ICD-10 coding system. But with heavyweights like the American Medical Association openly expressing their hesitation and having valid concerns for the upgrade, 1 year delay was granted in the hopes that administrative issues as well as financial burdens could be resolved. The AMA had foreseen these issues for some time. In 2008, they conducted a study that found, on average, this code change would financially create a burden of approximately $83,000 for smaller physician offices, while a heart-stopping $2.7 million for large group practices. So it has warranted fear that due to learning new process requirements for claim submission, trying to work out the kinks, and other potential problems creating reimbursement delays, this could have a catastrophic impact on smaller practices. For these reasons, many healthcare providers are very hesitant in moving forward to the ICD-10 coding system. ICD-10 uses substantially more specific codes, increasing the stress on providers that they will meet documentation requirements. No longer can you just report otitis media unspecified. You will also be required to report information such as exactly which ear is infected. There is concern that decades of old habits will be impossible to break, even in such a short amount of time, even with this 1 year extension. While there are many valid reasons why another delay would be helpful in the upgrading process, it cannot be forgotten that ICD-9 coding system has far proven that it lacks the ability to keep up with the industry. Frankly, this system is outdated. ICD-10 brings thousands of new, more specific diagnosis and procedure codes. This chart shows a comparison between our ICD-9 and ICD-10 coding sets. ICD-9 currently has 3,824 procedure codes that will increase to almost 72,000. And our diagnosis coding will go from 14,025 to almost 70,000 diagnosis codes. This is going to allow for a more accurate picture of the services rendered. ICD-9 coding has well proven that it has limited selection with subjective terminology. One of the biggest goals with these quality measure initiatives is to increase safety for patients. Having a coding system that is more concise in reflecting a patient's diagnosis and procedures that they are receiving is a step in the right direction. It is so crucial to have a tracking system in place to help identify injury, and disease statistics. With more accurate coding systems, healthcare providers will be able to assist researchers in identifying the relationships between diseases, in turn assisting with disease prevention. Having such specified information attached to the charges will also drastically reduce, if not assist in eliminating, the amount of time that is spent by follow-up personnel working on payment denials or delays. Cleaner claim submission can only enhance reimbursement, not hinder it. There is always concern for the need to prevent abuse or fraudulent charges, even if it's done unknowingly. Because ICD-10 coding is so specific, this measure will help health insurance companies detect and prevent fraudulent or abusive claim submission, which accounts for billions of dollars each year. For providers, using such a specific coding system will drastically reduce the headaches and stress of RAF audits. The truth of the matter is that we have maxed out the ability to add new codes to ICD-9 coding system. It would be like a family of 10 trying to sustain a comfortable life in a 2-bedroom apartment. It can be done, but upgrading to a comfortable living space has many outweighing benefits. The move is hard and can be expensive, but the result will be a harmonious environment where productivity can be increased because they have the space to do so. The reality is that there's no turning back. ICD-10 coding will be making its debut regardless of the growing pains. With the right preparations in place and being willing to evolve with the changes, the HIM department will be able to move forward successfully. There will be no need to fear October 1st, 2015 with the implementation of ICD-10. Thank you.